Welcome, Dr. Amardeep, at Innovations in.
Good morning.
Thank you, ma'am. At Innovations in Cardiac Therapeutics 2025, and thank you so much for the interview, ma'am. And how has been your experience at the event, and what were your major takeaways for the event?
It was a very well organized event by Dr. Nityanand Tripathi and his whole team. And the key points of this conference were newer techniques which are coming up in cardiology. How do we cope up with them, and what are the significance in our clinical day-to-day practice?
Okay, ma'am. Ma'am, this conference covers everything from non-invasive diagnostics to complex interventions. From your perspective, which innovation discussed today has the potential to change day-to-day cardiac practices?
First of all, I think the most important is the low dose of contrast in CKD patients, because nowadays, because of diabetes and hypertension, CKD patients are rising day by day, and we have contrast-induced nephropathy. So if we use low contrast, very less amount of contrast, the damage to the kidney is less. So I think that is a very new innovation, and I think it should be taken up again and again, and new research should be done on that also. Plus, disappearing stents. I think that is a new kid on the block.
Yes.
So that will work wonders.
Okay. Ma'am, what new drug devices emerging? How do clinicians balance guideline-directed therapy with real-world patient challenges?
So what we learn over here in conference is all theoretical. Plus, we have to all those implications in the patients. We have to modify sometimes because each patient is separate. So practically we have to see, but guidelines teach us how to go about it.
Okay. Ma'am, what one message would you like to give to the young cardiac doctors coming in the industry?
That keep on learning new modalities, be passionate about your career and cardiology practice, but be compassionate towards the patients also.
Thank you, ma'am. Thank you so much for your time.